let's dive in. Great. So my name is Sheela Roth. I am head of clinical education here at Pearl. Again, thank you for spending time with us. In today's webinar, we're going to talk about seamless case acceptance and how AI simplifies patient decisions. I'm very excited you chose to join us. Dr. Gantos has a lot to share with us this evening. Getting patients to say yes to treatment plans is always a challenge, but AI-powered digital tools are transforming that process, not only having more patients say yes, but they're accepting their dentistry earlier, so that's less invasive for the patient. By using these AI-driven visuals we're going to walk through tonight and a few other AI solutions in the dental space, we can help patients better understand their oral health needs, accepting treatment more often, like I was saying, creating more trust, and ultimately better outcomes. So today we're going to walk through some steps on how that looks and how that can look for your practice. I'm delighted to co-host this webinar with our wonderful partners, Oryx. And joining me tonight is Sydney Chick, the Director of Strategic Accounts at Oryx. Sydney, go ahead and say a few words for the team here tonight.
Yeah, thank you for partnering with us and allowing us to co-host this with you all. We love Dr. Gantos. She's my hero as well. So we're excited to hear her story and her journey where she's incorporated such amazing technology into her office. So I would say we definitely have an expert on this call who's really mastered the art of incorporating amazing technology and providing great results for their patients. So I think we're in for a fun treat getting to listen to her stories firsthand tonight. So thank you again for having us. We're excited.
Excellent. And thank you, Sydney, for joining us. And without further ado, let me introduce Dr. Gantos. And I got to meet her a little while back when we were talking about this webinar, and such a joy. So you guys are in for a treat tonight. And the most important part, I think, is her stories that she gets to share with us this evening and how she's gone through incorporating AI and how that's worked with her practice and her patients. So we're incredibly fortunate to have Dr. Meredith Gantos with us. She is a highly respected clinician and a thriving practice. You can see, aren't you in your practice right now, Dr. Gantos?
I'm in my kitchen, but it looks like
Oh, I was like,
this
this
is
is
what my practice
so
looks like.
beautiful. This is gorgeous. I love this. Well, I'm glad you're in your kitchen, but
The
that
power of technology.
that is
I'm in my kitchen.
that looks so nice there. Okay. So I was fooled, by the way. It's probably AI, right? So helping us.
Yeah.
But you are in Naperville, Illinois, specializing in sedation, surgical, and cosmetic dentistry, a master in the Academy of General Dentistry, and a master in the College of Sedation. So that's quite a lot. Very big accomplishments that reflect her dedication to advancing patient care. Dr. Gantos has fully embraced the digital workflow and AI. She's passionate about helping other doctors do the same. Today, she's going to be sharing her experience about incorporating AI into the workflow and how it's impacted patient communication and case acceptance. Dr. Gantos, thank you so much for joining us. Let's go ahead and dive in.
Thank you. Thank you. Thank you for having me too. I was real quick, I was reflecting, obviously knowing that I had this later today, I was thinking about it earlier in the day, and I was thinking how how great it is to be able to share some of this, especially because a lot of times when we're talking about technology and things like that, a lot of times it's like someone who has the luxury of seeing like one patient at a time. New patient exams are 3 hours. And I certainly practice in a very real setting, right? Like I'm managing lots of patients, we're moving quickly. So I'm really excited, and thank you for having me to be able to kind of, share what it's like on, the ground level with everybody. Certainly I can relate to, I think, probably a lot of people watching this. So
Yes, absolutely. We are so thankful just to have, like you said, kind of boots on the ground. You're not just running around speaking about AI, you're actually incorporating it on a daily basis, and sounds like in a pretty busy practice. So I want to start here. Also, remember, whoever's here, feel free to put your questions in the chat because we want to make sure that we are answering everything that you came to find out. Okay, so let's get started. Tonight, we're going to cover a little bit about what AI is, how AI is being used in dentistry, how we're using it for case acceptance, the clinical performance we're seeing, as well as where are we heading in the future with AI and Pearl's capabilities inside of Oryx. So what is AI? We hear about it everywhere, right? It's on everything. You can't even watch a commercial without hearing about AI. We've all been using AI for a very long time. We just don't actually know that it's actually AI. So using your phones, facial recognition, those kinds of things. And when we simplify AI, it's really easy to understand. It's a computer system that we teach it to solve problems, right? So now that's very simplified. It takes a lot of data, a lot of performant models, and a lot to generate these incredible features that AI can provide. But it really is the ability to do simple tasks that humans have trained it to do. I think that's important to understand is a lot of data is input, like a lot of digital radiographs, a lot of training, like thousands and thousands of dentists have learned, have taught, I'm sorry, the algorithms. And the output is what you're going to see this evening, where when you take a radiograph in real time, you will see, as far as radiological AI, how this is going to be the models working in real time, identifying different pathologies on your radiographs. So like I was saying before, AI is kind of snuck into our world, whether it's computer vision with facial recognition. I know my son was telling me he can go to a football game now and he can order a hot dog by walking up and getting whatever he wants and not having to even use his wallet. So I see that as convenient, although some people think that might be kind of scary. So we're going to walk through some of those instances where, incorporating new technology has a learning curve and has a little bit of a fear factor, if you will. Um, Autonomous vehicles, something completely new. Some of you have actually probably been in an autonomous vehicle. Dr. Gantos, have you?
I think I have. I think I've been in a Tesla that drives itself.
Oh, I'm still scared, although I don't know if I'm a better driver than the vehicle itself. And again, moving into natural language processing, right? We've used, those of you that use ChatGPT, Siri, all kinds of things are using on a daily basis. Lastly, predictive analytics. We use them now in basic things like jumping in the car and using navigation. But what about if a radiograph that we looked at a few years ago, we're looking at those incipient lesions and we're trying to predict when that enamel, when that cavity is going to move through the enamel, right, into the dentin? What if we had predictive analytics to help us out with that? And that's really what we're looking forward to in the future is more data to give clinicians to make better decisions. So what is AI doing in dentistry now? You've probably heard about it a lot. Enhanced scheduling, diagnostic assistance, insurance verification. This really helps streamline workflow and staffing. There's a lot going on with even hiring, right? People are using AI to review resumes, to verify insurance. And tonight we'll talk more about radiological AI. I think on this call, we all agree that the quality of dental care begins with that first X-ray analysis. And as we move through this evening, I just want to share with you some of the capabilities that AI has to offer your team, from periapical radiolucencies to notable margins, bone level measurements from CEJ to bone crest, completely customizable and increasing color based on severity. You're also seeing calculus boxes, impactions, and again, you're going to see areas of caries, two different colors. So for those of you that have never seen AI, this works in real time on your existing images. So we're going to play a game and we're going to pretend we're not in the office, which hopefully you're not, trying to get a patient numb, do a hygiene check, answer the phone, call your spouse back, pay some bills, right? All those things are going on while you're trying to review this patient's x-rays because you're running to do an exam. Today, we're going to just relax and review this radiograph, like most doctors do that are not in dentistry, right? They go to a radiologist. The radiologist gets to look at an x-ray and then they send their information back to the surgeon. Well, in our world, the dentist does it all, right? So that's hard to do. So how many areas of decay? What do you guys think? We'd love for you to put this in the chat. Kimberly, if you're around, we'd love for you to call out those numbers for us. How many areas of decay? Now, I'm not asking how many teeth you're going to fill, but how many areas of decay do you see on this image? Any answers yet? Dr. Gantos, you're
No, oh, here we go. 6. We've got a couple votes for 6.
okay.
We need some more votes. 8. We have another vote for. 6 seems to be popular. 7, 9. 7.
Right. And these are our stellar clinicians, right?
6.5.
6.5. That's awesome. These are our doctors that are spending their free time after work or at work, right? Coming for more knowledge and more information. So these are our top doctors, and yet we still see a little bit of inconsistency, right? Which is fine. The AI said that there were 7 areas of decay. So that's very interesting, right? Now I want you to just kind of put this together very quickly. It's nice when you're looking here. Now, I know you guys are all probably wanting to chat and say, Sheila, I don't have contrast and zoom and, all those things that we all use. But at the same time, this is so helpful, so much easier. You can quickly turn this off to make your final diagnosis, right?
Well, and to speak to that, right? How much do you want to sit there having to zoom, having to clarify, having to change contrast, to your point, when you're trying to work efficiently, but also really, really accurately, right? Which our patients deserve. How nice is it just to be able to kind of turn that button on, see it, turn it off, verify it, right? And, not have to sit there and second guess yourself and change all the settings. And, I mean, that's what you want, right? We want to work efficiently, but also be really accurate for our patients.
Absolutely. So when you're reviewing radiographs, how many patients are you kind of, I guess, juggling, on average per hour? And how often, like how fast is your radiograph review, right? You're like your own computer, you're your own AI. Because the way you analyze is like left to right, go through the full FMX, right? So tell us a little bit about how AI has maybe helped save you time, or also maybe pointed something out that maybe either you disagreed with, or maybe you thought, oh, I'm glad that's there. Patient came for a toothache. I wasn't looking at number 3. I was looking at, number 30, and there's an incipient lesion there.
Right. I mean, there's so much I want to say, and I know we have a full webinar, so I'm gonna try and
Go
get it
ahead. Go right ahead.
But yeah, for us, it's one of those things, I've shared this before with other people. I really am a tech geek, right? We have 5 XS mills, 3 XS mills. I've got 5 3D printers, every, type. We've got 4 scanners. We've got, hard tissue lasers. We've got all the things. And I love those toys because they help make me maybe more efficient or more accurate or things like that. But they're all redundant, right? If I don't have a scanner, I could still take an impression and get a really perfectly fitting crown. If I don't have a 3D printer, I don't have a mill, there's still workarounds to get to the same finish line. And the thing I love about the AI with the x-rays is there really is no other workaround. Like, yes, I can interpret it with my eyes, of course, but to have that free second opinion, to have a way to empower our team, particularly my hygienists, to have the conversations before I walk in the room, to diagnose, to talk about prevention. I saw someone comment in here that some of these are incipient. I wouldn't necessarily do them at this time. Me neither. I totally agree with that perspective. And I'm really glad that, you would say that, because we would treatment plan very similarly. But the beautiful thing in Oryx is I can chart if it's into enamel, if it's into dentin, deep into dentin. I can track that. I can hover over that lesion, and Pro will tell me the depth of penetration through that enamel, right? And that's super powerful because this is a patient I can talk to about prevention plans. I can make a customized treatment plan. We can talk about basic bites. We can talk about CTX products. We can talk about why are we getting these incipient lesions? How do we treat these, prevent these? I can build value with this patient. My hygiene team can build value. We can help them because ultimately we don't cure anyone of cavities, right? We treat cavities, and that's a really different dynamic for our patients. So the less I have to drill these teeth, the more I can empower them to, remineralize an enamel to keep things that same size. That's the best service I can do for this patient, but that's also how I build trust and a rapport. And that's how my practice grows without having to market and having to overtreat and overdo things, right? Patients see that and they feel that, and it's so authentic. We just had a couple weeks ago, and actually I saw my hygienist who saw this patient is on this webinar, so shout out Megan. But we just had a fantastic Google review from a new patient who literally said that he is purposely going to an out-of-network provider to come to our office, and it was the best new patient experience because of the level of education and this whole process, because she took the time to go through the x-rays to review, hey, this is what this means, this is what we do. And he literally said, like, we needed to teach a course, which I thought was really funny, on how to do this stuff. It's literally one of like our most recent Google reviews, but it just builds that trust with the patient. And again, we have, the luxury of taking routine x-rays. So I always say to patients, hey, this is what we're seeing now. It means you might be a little higher risk. So we're going to go ahead. I would prescribe that in another 6 months, we take these. We don't want to wait 12 months and have this become bigger, right? And they understand why we want to prescribe that. If their insurance doesn't cover it, they understand the value of why it's meaningful for their mouth and maybe not their spouse's mouth. So again, it's just really helping create that personalized, customized care for patients. And I totally didn't answer your question, which was about navigation and managing multiple providers and things like that. But in our office, we actually look at the x-rays with the AI on first, and then we turn it off, which might sound counterintuitive. And I suppose if I really wanted to like test myself every day, I would do it the opposite way, right? And be like, oh, did I catch that? But again, I'm not playing games. I don't have time for that. I'm managing 3 hygienists. I'm managing 2 restorative rooms. I'm running the business. I'm running like a chick with my head cut off. So I just want to look, give me the data. Let me turn it off and verify, right? Because at the end of the day, I'm still the doctor. I still have Dr. Brain. There's always going to be angulation or certain things that I may want to take into consideration. Maybe I want to look at the previous x-ray. Maybe I want another angle. But it definitely makes the visits more efficient, because at the end of the day, my hygienists know I want to be able to walk in, smile, look cute, seem like I'm spending a lot of time, but really they've done the legwork and I'm just co-signing the things that they said. And then I want to be able to walk out. And if that hygienist has talked about fluoride because we have incipient lesions, they've talked about products, they've talked about Curodont, they've talked about how we want to manage that radiographically moving forward, I just get to say, yep, what she said, and then I get to walk out.
I love that. I know. For me, when I was practicing as a hygienist, there was such a great relationship with that handoff, right? If I had some time ahead and then you came in and I'm like, okay, so my patient Kindle here has been living on Gatorade for 2 years now. But I think there's an interesting perspective that was brought up in the chat, which is really important to really lean into here. That when we're highlighting pathologies, there are 2 colors for the exact reason of incipient, enamel only, and progressed into the dentin. And I'm so thankful that somebody said they wouldn't fill all of these. This is actually my best friend's daughter. So she had come from a pediatric office, came to my practice that I used to manage, and was like, what is wrong with your practice? They're crazy. They said that my daughter had so many cavities. And so, of course, let's turn this back around, right? This is what we're showing our patients every day, right? How many think, do you think the patients have any idea? We have all sat here, myself included, and said, do you see this beautiful white enamel? Do you see this gray thing right here? Right? Or we're circling it, or we're like standing close to the monitor, and as if they've taken radiology, right? So how many areas do we think the patient saw? I think this is probably pretty accurate, right? The patient didn't see anything. They don't feel anything. In fact, this patient didn't even believe us. So I love your story about the new patient, because you know, when we're talking about new patients, we really kind of have to focus on infusing trust. And when we look at this and we think about 40% of patients, they do not trust the dentist. That's very alarming still with all the new technology. But the same thing is patients don't understand x-rays, right? 64% of patients say they don't understand their x-rays. So being able to have new patient visits where you are educating them, you are simplifying areas of concern, really kind of infuses that trust back into the patient. So how many areas of decay do you think your patients would see now? Right? And this is how you're presenting the dentistry. So I love what you're just saying. Those of you that wouldn't fill these areas absolutely agree. This would be traumatic. This patient's 20 years old. We're just growing them up to be crowns at this point, right? So we have to slow down that disease progression. And Dr. Gantos, you said it yourself, where this is a perfect hygiene flow, curodont, or by the time you walk in, you say, yep, we're maybe going to do that one on the lower right. There's a small little area here you can see, Kendall, that this is actually turned darker pink. We're probably going to need to get that one, but let's take a look in 6 months, see how your flossing's going, right? So it really kind of brings that case presentation to a simplified and really next level. So I think that was really one of my questions was, I think you've already told us here that you have the AI on and you turn it off. And I love that because it probably really simplifies. Okay, I sit down, I'm going to look at everything, and then I go, yes, okay, I'm ready to go see my patient now, which your hygienist has already warmed up. Anything else you want to share with us on this?
Yes, I do. Sorry. So, there was a great comment in here that said, I noticed Pearl seems to be rather aggressive. I wouldn't use the term aggressive. I don't think it's aggressive, but it's very sensitive. So yes, Pearl is very sensitive to identifying changes in the enamel, which again, as long as you're not a sociopath, right? And you're not going to drill all this healthy enamel in people's mouths, it's not really a problem. It's an advantage because you can, again, build that rapport with the patient, talk about prevention, talk about, hey, you got to get flossing, right? We've got to, get you on maybe a higher prescription toothpaste. Maybe this person's not using, nanohydroxyapatite or fluoride. Maybe they're using, God knows what random thing off Amazon, right? And you get to have a come to Jesus moment with this person and be like, you're gonna ruin this. You're gonna ruin all these beautiful teeth for us. Stop doing this, right? So it just really, again, helps us communicate with the patient. One of the things that I really also love when it comes to the diagnostics and treatment planning is it takes something that is subjective and feels incredibly subjective to patients, right? How many patients do we know, or I see in the mom Facebook group where they're like, I went to one dentist and they told me I had 500 million cavities, and I went to another one and they said my teeth were perfect. And, there's, to your point, feeling that dentists are like used car salesmen. They don't trust us. They think we overtreat. They think we pull it out of a hat, right? What doesn't need treatment. And every office they go to, they'll just find someone to give them whatever answer they want versus, a real answer. And so to me, that's one of the really valuable things about AI and this type of technology is it takes something that's subjective and it makes it much more objective to the patient. And instead of me interpreting their x-ray and saying, this is what I think, and this is what I say, and this is how I feel about it, and you should believe me, even though you can't differentiate between these shades of gray, right? It says, I just become the messenger. I just say, when we talk all the time, we always hear the term co-diagnosis, right? It's really co-diagnosis because it's me saying, I'm not the bad guy. I'm not saying anything. I'm just walking you through what the story is showing. And this is how we address that. If it's on the enamel layer, this is how we address it. If it's through that enamel layer, if we turn on the colors and you can see it's all the way into your nerve, or there's, a blue periapical lesion, right? I'm just reading the story to them and walking them down the road rather than putting my own subjectivity. And that really changes something for patients. It changes the entire, discourse, right? It changes the whole conversation because it's less about them being defensive, like, well, I don't believe you. Well, I never had cavities before. Well, that makes no sense. My teeth were perfect. To, yeah, I see that. It's irrefutable, right? And we for whatever reason, good or bad, all have this belief that a computer or AI technology is somehow superior to the human brain anyway. So we trust the AI much more. There's times where patients, patients of my practice, I don't love necessarily peds. I don't do a lot of peds and I try and get them to go elsewhere, but they'll take their kids somewhere and they'll be like, oh, they told me I had all this stuff going on with my kids. And I'll be like, need X-rays. I'll run it through my AI and I'll do that. And I'll be like, yep, their teeth are terrible. Sure is. Like, here you go. They weren't mine, and it's great to be able to do that for patients. And again, kind of build that rapport because whoever they're seeing doesn't have the AI to show them that. And literally all it takes is me running it through Oryx on the AI and be like, nope, see all that? That's all cavity. Yep, they need lots of treatment. You're good. Go ahead and get it done. There was one more question too that I just want to clarify because it's a beautiful feature about it as well, which is, are you able to quantify caries changes over time? And yes, it does. If you hover over that little pink, it gives you a percentage of depth of penetration through that enamel layer. So you can compare that radiographically to see, is it getting bigger? Is it getting smaller? Again, like logic brain, angulation will make a difference, right? So keeping in mind that, if your contacts are completely overlapped, that's going to be different. You may ask the provider, the clinician, hey, can you open that contact for me so I can actually really compare it? But absolutely, and that's a great feature to show patients too. There's times we're watching something, it's getting bigger, it's getting bigger, it's getting bigger, and you can illustrate that to the patient and show them that.
Yeah, that's a great point too, is we want to be able to use our comparison images. And also within that last image we saw, it's easy to compare areas we're going to watch versus areas we're going to treat because they're two different colors. Like patients are starting to come in now and say, I hope the light pink ones haven't turned dark pink. I've been flossing, right? And that's what you want because then they're better informed to make their own decisions. So I think that's crucial. How many areas of calculus do we see in here? Anybody want to guess real quick? We'll go through this a little bit faster. This is where I think, hopefully as a hygienist, you're not taking this x-ray post-op after you're scaling and root planing, but really where we kind of focus here is new patients coming in. What do you mean I need a deeper cleaning, or I have 4 visits, or it's $1,800, or I need anesthetic, right? It's very foreign to them a lot of times. And hygienists have to do a really good job infusing trust. When you look at those Yelp reviews, they talk a lot about deep cleanings and how it really freaks patients out because they've never heard of a deep cleaning, right? So, Kimberly, what is a couple of the answers here we're seeing with the calculus boxes?
We have some 5s, some 6s, a 7, and they're still coming in. But so far, an 8.
All right. So we have 6 here that the AI has picked up. And Dr. Gantos, as far as like scaling and root planing with this detection itself, does your team focus on using this chairside with the patients? How do you deal with, I know we're going to get into bone levels in a moment, but as far as just identifying calculus and such for your hygiene team?
Yes, absolutely. It's certainly, the thing that I noticed, and maybe it's specific to my office, my hygienist. I don't think it probably is, but one of the great things I noticed in my office is my hygienists, understandably so, were always very timid about talking about radiographs and interpreting because at the end of the day, it's doctor's job. They're going to co-sign whatever doctor says. So I always had a little bit of a challenge when it came to trying to kind of build their confidence on talking to patients about this stuff and pointing it out. And when we integrated Pearl, it was like a night and day difference. I mean, they are so confident when they talk about this stuff. And I think, again, it just really, it's not that the AI sees things that they don't. They were seeing it. It's just that extra confidence boost to say, okay, I know I'm right. I have this second opinion. I have an easy way to show it to the patient. And it's that just extra confidence to say, I can go ahead and show this and talk about this before doctor even co-signs it, before I have to run a doctor's office and be like, okay, I think this is SRP. Is this, it helped enable them to really have that autonomy and have that confidence with patients.
Excellent.
And
Yeah.
from an insurance standpoint too, it's also really nice, right? Because I can take a screenshot of that. And if that kicks back from the insurance company, I can say, whoa, 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 like, that's funny you said that because, check this out. And again, it's not me saying an insurance company, it's AI.
Absolutely. I love that. So when we look back at the history of modern dentistry, we can see these various technological advances that have really pushed our industry forward. We moved back from braces, toothpaste, high-speed drills. I mean, all of us probably remember back in the day, well, maybe not all of us, but you know, before digital x-rays. And now we're at a place now where we have digital dentistry, digital scanning. So we really see AI as really kind of next level. And over the next 5 years, feel it's going to be incorporated as one of the main utilities in dental practices. So turning on your air, water, suction, and AI is going to be really commonplace soon. So you talked a lot about patients that, go to different practices. I'm sure we've all experienced where they walk in and they have this laundry list of, I went to this dentist down the road and I'm here for a second opinion. Those are always my favorite because in my practice, probably very similar to you, our doctors are very ethical. And it was great to say, yes, you need these 3, but you don't need these 2, and never throwing another doctor under the bus. But having AI as a built-in second opinion is huge. The clinical inconsistency is for sure the foundation of distrust in dentistry, which is a bummer, like you were saying with the mechanics. I'm going to go over a story here in the middle. There's a lot of research on our website if you guys are interested, but we took almost 9,000 images and we took 3 different doctors. One was a radiologist and 2 were seasoned clinicians. And we just had them circle cavities on the x-rays, They could only agree about 4.3% of the time. And that was very interesting. And it wasn't, are we going to fill it? It's just, is there a cavity here, right? But what I found most interesting was these same clinicians came back 90 days later, looked at their same images, and they only agreed with themselves 70% of the time, right? So that happens. And it is nice to have the second set of eyes. I think it's important to remember this as a full team tool. I remember in hygiene school, it was like, you don't diagnose. They like tell you that like when you walk in the door every day. Although we're looking at x-rays probably way longer than most other clinicians because we get the joy of having our patients for a long time. So I love that AI is helping hygienists not only confirm areas from a periodontal perspective, but also it's really kind of empowering them to have those conversations about incipient lesions. And imagine that image we saw earlier. If we don't arrest that decay, that patient is going to have those same cavities restored again in 12 to 18 months. So it's important that we see this as your team supports you and it's up and ready for you, like Dr. Gantos is saying, as they move into the operatory. So when we look at case presentation, we really do kind of take it from night to day. And those incipient lesions, again, are great to keep an eye on. Great way to build your practice by saying, I'm not going to fill these light pink lesions. In fact, those of you that are feeling that it may be aggressive can actually suppress those throughout your entire organization. So you only see the dark pink lesions, but also knowing that patients want to see that. They want to know that you're not going to fill all of those. In fact, that patient earlier, they only filled 1 tooth, right? So I think one of the myths in AI is that it's diagnosing for us. So I'm going to turn this over to Dr. Gantos because it's important, I think, to level set on the expectations of accuracy as well as, when we're talking to our patients, is there a fear factor that, oh, okay, so the AI is just diagnosing and you were in Hawaii and now I have to do 3 cavities on Tuesday. So tell us a little bit about accuracy and also your own feelings about the AI replacing a dentist from a diagnostic side.
Yeah, those are great questions. And I think those are very common reservations or questions that honestly a lot of people have when they're considering this type of technology. What I would say and what I consistently say to people is, if you're looking to not do your job, and that's your motivation for, something like Pearl and AI, that's not what this is for, right? If you're looking to say, I'm going to have my assistant turn the AI on and read the x-rays and I'm going to, sip my tea in my office, that's not what this is, right? There's still doctor brain. You're still looking at, again, angulation, I think being the biggest thing. Also, just the bone trabecular pattern, right? Sometimes that can be a little tricky looking at, I mean, whether it's AI or not, different, periapical lesions, widened PDLs, things like that. You're still using your brain, right? Is this an apical scar from an RCT that's been the same size for 100 years and maybe isn't really, an issue and something we just want to watch versus, an active, infection, right? Or something that needs treatment. So there's always still going to be doctor brain interpreting, understanding, knowing when you want to say, hey, can you open up that contact for me, right? Can you get that from another angle? I want to double check that I'm really viewing that in an accurate way. So it certainly doesn't replace the doctor. It's an enhancement. I think I shared with you kind of privately, it's almost embarrassing to say out loud, but I'm going to say it anyway. There are times, because I look at the x-rays first with the AI on and turn it off, there are times sometimes where there's a periapical radiolucency and it's there and the eye catches it, I turn it off and I see it. And I have to kind of second guess myself, like, would I have seen that? Like, I think I would have. I think I would have caught all that. But to your point, sometimes when you're moving quick, you're managing stuff, some of those can be a little tricky. There are definitely times where I'm like, really glad that I look at that first because I'm pretty sure I would have caught that, but it's just really nice I don't have to second guess it. You know what I mean?
Absolutely.
And you can, if you're wanting to show a patient an X-ray and you're like, oh, I don't agree with this, I really don't want them to see this, you can click it and turn that specific item off. So I can say, no, this is invalid. I don't really think this is a thing. I want to hide this, but show everything else on the X-ray or something like that. You are able to do that. This little picture here where it shows the enamel layer white, the nerve, I love this and I use this a lot for patients, particularly when we're talking about possible root canals or for sure root canals, right? It's super duper helpful to explain the depth of a lesion and how it approximates the nerve, especially if they're asymptomatic, right? Because a patient in pain, that's an easy patient to treat and diagnose. All they want to do is get out of pain, whatever you tell them, right? They understand, okay, yes, there's a problem. But when someone's asymptomatic and they have a lesion that's really near the nerve, that can be sometimes challenging for people to understand, right? Well, it didn't hurt before you touched it. I came in thinking I was getting a filling. How did I end up with a root canal and crown, right? So being able to have those conversations ahead of time to say and really show in a way that people understand that, hey, listen, I know it's not hurting you now, but I want you to understand the depth of this lesion, how it's approximating to your nerve. There's a really, strong possibility that when we remove that, that can be so close to your nerve that your nerve doesn't react favorably. That's the case. This is what that treatment looks like, right? You can preemptively have those conversations. So if you are able to just get a filling in there or, not have to go full root canal crown, you come out a hero. But if you're not, it's also not an upset patient at you. They knew that. They understood that. They consented to that. They visually saw that it's not like, oh, the doctor drilled too deep. I don't know. I'm sure everybody's heard that at some point in their life when they're, talking bad about why they switched off as, oh, the doctor drilled too deep and I had to get a root canal. No, the cavity was there. Like the doctor took out the cavity. Nobody's like drilling with a blindfold on. Like that's how that works sometimes. But it's about having those conversations, illustrating that up front. So I really love this view in particular, and you can toggle off and on. So, looking at the screen, this is exactly what it looks like in Oryx. That little AI button will turn perfect. Yep, it turns it pink on the black. That's that first button. And then when you actually hit that bottom button, you can show all the different colors, and then you can turn it off too, right? So we can look at all the different tools to be able to show patients.
Yeah, and one thing too, I think we could have you back for a webinar on just what a wonderful job you do with setting expectations with patients, right? And a lot of associates I worked with, they wouldn't feel comfortable talking about this may or may not become a root canal, right? As if that's a scary conversation. But I think that's important. Like consumers want to know, and patients need to know what is happening in their mouth. And a lot of times using these very simple pictures helps them understand these expectations. Now, inside of Pearl Second Opinion, which fuels the AI, that is a standalone product that you would just use a password to log into. What we love about our native integration partners is there's no extra step. So Oryx has done such an incredible job of allowing the clinicians to not have a new workflow change. You're in your same system, you have your imaging ready to go, you click on the patient, and it's two buttons, AI on or off, hover over if you don't like the detection, and the tooth parts. Like a lot of teams just say, make sure this tooth part section is on with when the doctor comes in to do this exam. So I love that Oryx spent so much time really focusing on beta testing, figuring out what their patients wanted. They used a lot of feedback, and they moved into creating this incredible integration where it's truly seamless, right? You don't have to go outside of your imaging system, close it down, open something up. So I think that's really key to make sure those of you that are interested in Oryx, that are using Oryx, are aware that it's very easy to just get Pearl turned on so that your teams can start experiencing this. I think that's one of my questions for you is, what are the benefits of having it right there for you? And how has it helped you kind of overcome goals or overcome challenges and achieve some of those goals, maybe case acceptance, that kind of stuff?
Yeah, so I oftentimes reflect on the fact that I feel like business ownership is a constant exercise in efficiency and accuracy, right? So the doctor part of me is all about how can I be more accurate? And then the business side of me is how can I be more efficient? So anything that takes both of those and combines them, that's how we're able to serve more patients without sacrificing quality, right? But also with increasing our profitability. When again, you make it an objective, third party, independent, I'm walking you through the story. Here's what the story tells us. This is what we do with this information. No one says no to that, right? Outside of financial reasons, which, okay, understandable. If you can't afford, you know, crowns upon crowns or, whatever the treatment is, well, let's break that down. Let's figure out how to make that afford, right? Like, let's prioritize and let's figure that out. But outside of like phasing things from an affordability standpoint, it really negates the doubt. It negates well, I don't believe you. And it's funny because I mean, there's patients in my practice sometimes where I hope everybody has this. It's not just me, but where I'm like, you literally hate my guts. Why do you come here and torture me and torture you? Like, you don't believe anything I say. You don't like me. You don't like being here. Why do we do this? And it's funny because I've had, not a lot of patients like that, but I have had a couple of those patients. And there was one, she was, middle-aged, has never had a cavity in her life. I told her she needed 4 restorations. And she was just very upset about it, very grumpy about it. It was just like, well, my old dentist never said that. Okay, well, why did you leave that person? Go back. Like, you clearly hate me. And, pulled up Pearl and I explained to people, listen, you have full autonomy. Nobody here is going to like strap you down in this chair and start drilling in your mouth. My job is to give you the information to be accurate and make sure that you can make a well-informed decision, right? After that, the burden is on you to decide what you do or don't want to do. And begrudgingly, pulled up the x-rays. I turned on Pearl. I showed her what we do treat, why we recommend it, what we don't, right? I'm showing the enamel layer. I'm showing some of these symbiotes to say, we don't treat these because these are, I'm going through the whole spiel. And although she hated my guts through every ounce of it, right? She came back. She got all those fillings done because ultimately she understood that despite her wanting to, be combative and aggressive and upset about it, like at the end of the day, I wasn't lying about it, right? She could be as mad as she wanted about the whole thing, but that was just the reality of what the situation was. So I think from a profitability standpoint, achieving those types of metrics and goals, it's a no-brainer. I mean, if you help patients understand the need for 1 extra filling, it's paying for the software alone, which you're going to do infinitely more than that. But when you're talking about even goals or things like just managing a patient load, I, as a single provider, manage an ungodly amount of patients that I shouldn't be as a single provider who doesn't even work 40 hours a week. but it's because we have efficiencies in. It's because I have a supportive team. It's because I have really competent, confident hygienists who I can really co-manage well with, right? I'm not having to overcompensate for someone not carrying their weight, right? They are super comfortable and confident with both Oryx and the charting, the AI, the Pearl. And so that really helps me be able to manage a really, large patient population for one provider, but do it really thoughtfully without sacrificing quality. And also, obviously, that turns into profitability. So certainly, I think it just helps us serve more patients with quality care that they need without making us the bad guy.
And have you had any patients concerned or worried, or a study tells us that 87% of patients prefer to go to a dentist with the latest technology. And I think in the near future, we're probably going to have people asking, do you use AI? Of course, I work for Pearl, so I feel that way. But my question for you is, um, sometimes doctors want to know, do the patients think it's weird when you have AI?
Our patients love it. Now, granted, my patient population is probably skewed because it's not just AI. Like, I'm definitely a very modern tech-heavy practice, so I'm sure my patient sample is probably a little skewed in this regard. Our patients love to see it. Like, they ask to look at it, they ask to see it, they love to turn it off and on. They think it's fantastic. They totally buy into the experience. They really love it. They value it. I'm kind of with you. Sometimes I'm a little like bougie about it when someone's talking about like, oh, I went somewhere and they diagnosed all this, and I went somewhere, and I'm just like, oh, they don't have AI. Ooh, I don't know. You should probably find someone that has AI that can just, take the subjectivity out of it for you, right? So I love being able sometimes to just say that to patients, like, oh, they don't use AI, really? Um, because again, it's cheeky, it builds value, but it just takes that level of human error, perceived by patients out of it, right? And to kind of backtrack and speak to that native integration, of course, that makes it super duper easy. It's really streamlined. It's very quick. There's not like a really long lag or wait time or anything like that, which I really appreciate. When it very, very, very early on first got integrated with Oryx, we were early adopters. We jumped right in because, quite frankly, I'd been looking at AI prior and it wasn't integrated, right? It was an extra step, it was an extra everything. And so at that point, I didn't adopt it. So when it was native, I was like, heck yeah, sign me up. I've been like drooling to do this stuff. And very, very, very early on, when they were sorting out some of the kinks, we would have a couple days here or there in the very beginning where maybe it wasn't registering right away or wasn't working right away. And literally my hygienist and I, after probably like 2 days of using it, it wasn't even a lot. If it didn't work immediately and perfectly for us, we were like, cancel the patients. Like, we don't even want to work today. If it's not working, we're out. Like, we're not doing this any longer. So definitely having it integrated, you really get spoiled with it. Like, if something were to happen, and it works really flawlessly now, but if something were to glitch or happen, I would literally just not even want to treat the patients. We're not doing x-rays today, guys. Just cancel.
Right. You definitely become reliant on it. That's for sure. As far as just that second set of eyes, it's like spell check, right? I don't agree with everything spell check does for me, but I'm really thankful it's there a lot of times. And same with Siri. When I tell her to send text messages, I'm always reading them, right? Or read it back to me, Siri, right? And it's the same thing with having AI as far as a diagnostic tool. I think this is an important question about, sounds like you already answered it though. You were already pretty excited about AI. What would you tell team members that maybe, or even doctors out there that might be a little hesitant? Might be good to look in our chat too and see if there's some questions about that. But most clinicians that I worked with in the past, when I first started at Pearl 4 years ago, it was, do I really need AI? And now it's, which AI company am I going to go with? So you were kind of excited about AI. Have you talked to colleagues that are a little bit nervous, or what would you say to someone who's a little concerned about incorporating it into their practice from workflow, or again, back to just those myths that it's taking your job?
Yeah, honestly, from my personal experience, I haven't heard anybody nervous about it taking their job. I think all of us would be okay with, the more the merrier, anything else can do, the more tea time I get. But I haven't heard those kind of concerns. I think personally, when I've talked to people, the biggest um, points of consideration or concern, it's the value proposition. It's if I'm going to pay extra for something, is it going to be worth it for me? Which when you're on this side of the it's like mind blowing when people like even have to ask. I'm just like, dude, you don't even understand how this is going to change your life, your case acceptance, how people aren't going to fight you. You're going to be able to explain everything. People are going to accept all the things. Again, you do 1, 2 extra fillings a month that's paid for, but you're going to infinitely be doing so much more than that when you can communicate to people. And again, it's not even just like the profitability and doing the treatment. It's really just the lack of headache. It's a lack of someone sitting there second guessing, saying, do I trust this person? Do I trust what they're saying? Do I need to go get 15 more opinions? It's just building that type of culture, that reputation, that rapport with other people to say, hey, this is very transparent and I understand it. I buy into it. There's nothing I really don't understand about this situation. Now it's just a matter of prioritizing, financing, figuring maybe that component out. But even just kind of building that value with patients to say, I genuinely care about you enough that, again, I think you build a lot of value with those incipient lesions, talking about those, talking about prevention or what that means or areas maybe to focus on. You had mentioned how you can turn that off, but a lot of people like to keep those on. I would 1,000% keep those on. I think that is such a tremendous value for patients. And, my hygienist very quickly picked up on what I do and don't treat. And it's really nice because I overhear them when they say to patients, doctor's very conservative about drilling teeth. She'll probably talk to you about, seeing these things, and we'll probably just want to monitor these for now. But here's tips and tricks we can, utilize to make sure that they don't grow. And so again, they're planting those seeds with the patients. They're building value that, hey, this isn't an office that's just going to drill and fill all your teeth. We care. So it's just, yeah, it's game changing.
Yeah, it's interesting too when you talk about really kind of that truth of ROI, right? And you look at a small fee, monthly fee to include AI in your practice. But I think it's important to be mindful that treatment acceptance here in the study that we did at Pearl was also teams using AI both before and then after. And what we found was this is treatment that was already recommended too. So you are going to find new things, but imagine if just your patients accepted the dentistry you recommended more consistently. In the first 90 days for most practices, if you're using Pearl chairside, and if you have a native integration like Oryx, we're seeing a 30% increase in the case acceptance by the patient. So that's more patients getting more treatment earlier, so they're not having things turning into root canals or crowns, which obviously we know has a great post-op experience. They refer their family and friends, and they keep coming back. I think that's the crucial part here when we're talking about case acceptance. When we look at the average case acceptance in the US, it's typically around 50%, and half of that for a new patient. So I think there's an issue in the US because patients don't understand x-rays. And if we can show them areas of concern and color, maybe they will accept the dentistry sooner. So that was the important part about looking at how this ROI would help you from a clinical performance perspective. I want to make sure that I just kind of walk through two things here and open the floor up for some more questions. We are moving into CBCTs, and ultimately you're going to see AI starting to help doctors save time by listening to your notes and being able to transcribe them and put them directly into your systems. Lastly, moving into disease progression modeling, right? Imagine this is one thing from a periodontal perspective, but how about from a caries perspective, right? And moving those enamel lesions, and what would we be able to see when we look at previous images, next images, and what would the future tell us? So I think the last thing I want to leave everybody with here is some questions and answer time with Dr. Gantos. I'm going to let Dr. Gantos kind of wrap this up. It's important to know that if you're interested in having a customized demo, we invite you to scan this QR code for Oryx. It's great for your team to see this together, and just your doctors too, if that's all you have time to do. But Dr. Gantos, what would be, before we open up for questions, what would be your kind of final concluding statements tonight?
Yeah, when you're talking about the future, other things that I think are just, I mean, obviously I don't work for the company, I don't know, but things that seem really obvious that feel like they would organically develop and come, there are things that I get excited about, right? I think certainly being able to turn Pearl on, have it identify things, and then have a way for that to filter automatically into the odontogram and already chart enamel lesions and chart things. Obviously, that seems like a logical step that will evolve. And then, obviously down the road, I think that even things like instant predeterminations from insurance companies, right? So we know that the insurance companies are using this stuff also. And, being able to take an x-ray, turn on AI, have some type of pathway to say, okay, there's this huge carious lesion in this tooth, and have the insurance company also acknowledge that, see that, and, send a pre-D back, whether it's instantaneous or in a very short amount of time, right? To say, yes, our AI agrees with your AI, / it's probably the same AI, right? And just kind of say, we approve that, here's what we pay for that. So I think that that's also really, both of those things, again, I'm all about efficiencies and accuracies. That's really exciting to know that we're going to have those types of automations, just to, again, be able to help our patients provide the most accurate charting and, estimations for people and things like that. It's really interesting too. Not often, and not because of me, but I've been subpoenaed in types of cases where I'm interpreting records and having conversations with lawyers who know nothing about dental. And it's really interesting the things that they like zone in on and pick up on, particularly when it comes to charting and in the odontogram. And as a result of some of those types of interactions, it's really made me realize like how important it is to be so precisely accurate. Like even things like attrition, where they're like, oh, well, was this wear from this fall, or was this wear from previous? And, it wasn't charted on this day, but it's charted on this day. So again, just to be able to have that level of accuracy and detail, it's game changing. But with respect to, kind of closing comments or what I would leave for people, again, kind of reiterating what I kind of said in the beginning about, to me, this is a technology I can't live without. I think it's not something that just enhances the way a lot of technologies do, where it's like, okay, well, I have a handpiece. Yes, a hard tissue laser is nice, but I could use a handpiece. I could use other things. To me, there's just no substitute for this. I'm not going to print off an outline coloring book and color it in for the patient, right? For them, like there's nothing comparable to this. And it's just such an important, powerful communication tool that it's really tremendous. And I think I said to you when we first met, I was like, I wish I had invented this. Like I think all the time, I'm like, I wish this was mine. I wholeheartedly love it. I wholeheartedly completely believe in this technology, which is why I'm very happy to be able to answer questions and hopefully help other people come to the light side, because it just is a game changer.
Yeah, and my final statements before Kimberly gives us these questions is, when I was talking with different beta customers, we were looking at, Pearl, and some of our beta customers, and we're like, okay, so we know you've been able to use both. What do you think? And they're like, hands down, any day, all day, native integration, 150 million%. So that is a huge gift to your teams, that you don't have to go elsewhere. So I think that's my joy here that I'm sharing tonight with the Oryx team. And like I was saying earlier, I remember working with their team early on, and they were very interested in how it would be best for the clinician, right? Where do we put the buttons, and how do we make this so easy? And that's when you're working with a really great partner and a really great company. So, Kimberly, I think you may have some questions.
I do, and this is perfect. And it's like, Dr. Gantos, you knew that this was going to be coming up, but there's a couple clinical questions that I think we can answer to get a couple off, and then I have a longer one for you as well. But one clinician noted that often they'll look at a radiograph, and then when they get in and are treating the tooth, they open it up, and it seems like there's much more than they even thought. Are you seeing less of those discrepancies with the AI, or does it sort of offset that difference? And is it predicting the actual caries depth more, or can you speak to that clinical difference?
Yes, I would say I do see less of that with the AI because it's so sensitive. So I personally think, I think I'm a very conservative clinician. If anything, I err on the side sometimes of being too conservative versus anything else. So for me, having Pearl, I think helped me better maybe start treating things at the appropriate stage, but maybe even a smidge earlier than I normally would have, if that makes any sense. And I've never trusted Pearl, opened up a tooth and been like, ooh, probably didn't really need to drill that one. If anything, if I'm on the fence with Pearl, and I've learned to really honestly kind of lean into it and trust it, because if I'm kind of on the fence and Pearl is like, no, this is at the DEJ girl, when I've opened it up, I always go, yeah, that was correct. And I, having talked with friends who utilize it as well, that's one thing that we've all kind of unanimously agreed on is it is super, it is sensitive, but it's correct. And I don't find it to be, like I open it up and it's 30% deeper and Pearl, didn't kind of make me aware of that. I find it to be accurate. And to be honest, I guess I don't really know how they take into account the level of distortion, but obviously it must be in the algorithm in some way because I don't find that discrepancy.
Awesome. Thank you so much for that. And then speaking of how it works in your workflow, and especially how the connection, you were saying that you didn't really use it until it was natively integrated, but are there any prompts that Oryx provides? Is it the X-ray detection tool? Like essentially, and then the follow-up to that that's related is how has your new patient experience changed since you've done them together? If you could speak to that a little bit.
Yeah, so when you, the screen that we looked at is exactly what it looks like in Oryx. So when you capture the X-rays, the radiographs directly into Oryx, in your viewer box where you can change contrast, you can highlight, you can magnify, there's just the literal AI button. So you turn that on, it turns all the different things colors. And again, you can hover over that to see what that means. It'll tell you open margin, it'll tell you calculus, it'll tell you caries into enamel 50%, whatever it is, right? So you don't have to necessarily memorize it, right? You can kind of look and work your way through it in that regard. And then again, there's an extra button if you want to kind of segment and color code the different layers of the tooth. And you can toggle those on and off with just a quick button, or there's even like a shortcut key. I'm pretty sure it's like Alt Shift or something like that. And you can also just even toggle it on your keyboard if you want, if clicking with the mouse is too exhausting. There are shortcuts. So it's super duper easy. It's not any extra step, quite frankly, because you're going to open up the X-ray. And if you're not using AI, you're probably using that like sharpen or contrast button anyway. Everybody uses a button. You can't look at an X-ray and not use a button. It's just criminal. So instead of using the sharpen, the zoom, the whatever button, you just use this button. And to be honest
I
with you,
love.
I never really thought about this until this webinar, but since we've had the AI, I really don't use any other button. I don't use, I used to always use the sharpen or the like zoom and that kind of stuff. I haven't touched those buttons. Interestingly enough.
The buttons are missing the love a little bit.
Yeah.
There's a quick question here about future capabilities, and thank you, Dr. Gantos, because there was a question about can it detect open crown margins, and you're like, yes, definitely and wonderfully.
Really,
So
really good
thank you.
too. Very accurate.
If anyone live missed that question in the chat, just so you know that you see that. This is a future capabilities question, and while I may secretly know the answer, I'm going to let Sheila probably grab this one. What about panoramic radiographs?
Panoramic is on the radar, coming soon to imaging near you. Yes.
Perfect. I knew that question was going to come up, so I knew it was going to be easy. And then you spoke a little bit about how quickly, Dr. Gantos, your team embraced it once it had the native integration. Um, can you speak just like a little extra, but like what was their initial feedback when you said, I'm going to be bringing this in? And how long? I know you're one hygienist, you said it was like as soon as it is natively integrated, you're ready to go. But like, how long did it take for it to become the standard of what you're doing every day?
Yeah, so I will say I find, and I know I have one of my hygienists possibly still on this webinar. So I say this with lots of love. I find the people on my team that are the most cautious about new things and new changes tend to be my hygienists. And they're very regimented, routine people. So when I like to introduce new things at them and be like, hey, now you're going to start scanning all these people with a new scanner, or now we're going to take, this photo series, or this is how we're going to rework this or do this. It always is a challenge, and we kind of have to go slow. We have to get a lot of buy-in, and it's always with a lot of like trepidation. Let me dip my toe in the water. So it's interesting because that's always been my experience with anything new with hygiene. This was like the most least friction, least resistance. I literally just said we have it. It's almost the equivalent of saying like we have voice perio. They're like, what could be bad about voice perio, right? What can be bad about something that just makes my life easier that I do all of the time? That doesn't require a new skill for me to learn, that doesn't require more effort, that isn't going to take away time from my already limited time to fit a lot of things in. So, again, my team, probably because I throw so much new stuff at them all the time in technology, and they're used to like, you know, being irritated with me about stuff like that. This was like something that was the least amount of irritation and friction. They truly immediately took to it, loved it just as much as I did from day one. I mean, it really took no time before all of us were like, if this didn't exist, we couldn't practice dentistry anymore. It really just became second nature. And again, I think for my hygiene team, because it did give them a whole new level of confidence, they were super quick to embrace it. There was nothing negative about it. It didn't take more time away from them. It wasn't challenging. They didn't have to type in secret passcodes to make it work, right? It's literally just a button that they click. They didn't have to remember anything, and it just made their lives easier. So that was kind of like, it's like the equivalent of I got them all new sharpened instruments. No one's fighting me on
Perfect.
it.
Love that. I love it.
I love that, of course. Yeah, exactly. I think I remember you saying to when we were chatting originally, and then I will pass this over back to you, Sheila, I promise. But I loved that you had said that the patients are even looking at the hygienists and the your assistants as more of the clinical team. And I think it's raising your team up and empowering them is like as a previous clinical person myself, I loved that you had said that as well. But
Like,
thank you, Sheila. I'm handing this back over to you guys.
Well, thank you guys for joining me on this webinar this evening. As a quick review, we talked about, right, what is AI? How is it working in the dental space? What is it doing for case acceptance, and how we can use it to streamline our basic workflows. So hopefully you saw some of that this evening. Again, we invite you to spend a little bit of time with Oryx, get a quick demo with them, see how this could be effective for your practice. If patients can start seeing what we see as clinicians, it's a better place for everybody. We're super thankful for our partners. Sydney, if you wanted to say anything, you can go ahead and close us out, and we look forward to seeing all of you on some upcoming webinars. Dr. Gantos, thank you so much for your time and your stories and all the work you do. And I will leave it in the hands of Oryx to close us out.